101.1 FM, AM 1160, and WCCSradio.com. Good morning, and thanks for being with us here today on this beautiful morning. It's dawned pretty nicely here today, and we appreciate that. And, all this month we've been talking about breast cancer. It is Breast Cancer Awareness Month. There have been events like the Love of Life 5K, like the Candle Bar event the other day. Very, very important. But what's most important about Breast Cancer Awareness Month is getting more women, especially, in for their mammograms. And that's what we're going to talk about today. Dr. Margaret Clark is with us this morning. Kelli McDermott as well, who is the lead, say it correctly.
Lead mammography technologist.
Lead mammography technologist, because I knew I would mess that up, at IRMC's Comprehensive Breast Center. Our visit this morning presented by Marcus and Mack, voted best law firm and best personal injury lawyer 4 years in a row in the Best of Indiana County contest. You can visit them online at marcusandmack.com. So as a radiologist, you obviously know the importance, but you are very much able to tell folks about the importance of getting your mammogram and getting them on a regular basis. I think a lot of people might think, okay, you get it once and then you don't have to worry about it anymore.
Yeah, that is not true. It's very important to have a yearly mammogram. There were some controversies probably about 10 years ago. The United States Preventative Task Force caused a lot of uncertainty with what physicians should recommend and everything, but even they've withdrawn their recommendations and saying that they should start at age 40. Mm-hmm. And then there's no limit. So often patients say, oh, well, I don't have to, I'm such and such an age, I don't have to get it anymore. Mm-hmm. That is not true. Unfortunately, there's no ceiling on breast cancer. And the thing that patients in their 70s and 80s need to remember is that if we can find it small, it's very treatable. Quite often with just a simple lumpectomy without additional treatment after a certain age. But getting your mammogram is just essential in finding things early, finding things small. As a general rule, if we find things on mammogram, we find them smaller than if they're found on, say, monthly self-exam, which is still very important as well.
Are women more likely in their 7th or 8th decade to develop breast cancer than they would be in their 5th or 6th? Does it get your chances get progressively higher?
Statistically, yes. The older you get, the greater the chance you have of developing breast cancer. The good thing is the older you get, it tends to be a bit less aggressive, but still so important to find it early before it becomes very large.
Yeah. Kelli McDermott, let's talk a little bit about the mammogram experience at IRMC and how it is done, and maybe put some folks at ease, because it is done very well and very sensitively. Yes. And it's very important that people be as comfortable with it as they can.
Yes. I think initially when you just come into our department, we have smiling faces that greet you, get you registered, let you have a seat in a waiting room. A lot of times we're like on the ball. You don't even get to sit in there. So we really do have a great team of mammographers. Bring you back, get you changed. I feel we all explain all the tests. If it's your baseline, we kind of have a whole different spiel basically that we go through to explain what's going to happen, how it's going to feel. And we do try to make people as comfortable as they can. We're there to offer any answers to any questions they may have.
I know that you would love to have that first mammogram at age 40 and have people come in when they reach that age marker. But some will be older folks
Yes.
who have resisted in the past.
Yes, we see that quite often.
Is it difficult to overcome whatever their fears were or their resistance was? Maybe not by the time you see them.
Maybe not by the time, I always say, oh my gosh, you're like 60. And this is just your first mammogram. And sometimes they're just scared or they don't want to see a doctor. So if they don't go to the doctor, then nothing's wrong. Mm-hmm. So just eventually they do kind of overcome that. And they're like, okay, well, we're going to come in, or a friend has, said, let's just go do this together. So
yeah. Come a little closer to the microphone, if you would.
Sure.
I want to ask about the actual experience of having the mammogram. How time sensitive must it be? When are the results? Is it painful? All of these different things that could be barriers to people who resist getting their mammogram.
Sure. I mean, I don't think it's the most comfortable thing in the world. Some people, when they come in, they don't think it really is painful at all. Other people are on the other extreme and they just think it's the worst. But sometimes I think they have it already built up in their head that it's going to not be a good experience. That's why I feel that when we talk to them, explain what's going to happen, why it's going to happen, why the compression comes down, why we use compression. And I feel like that does help ease them in there. The mammogram itself takes like maybe 5 minutes. It's very, very quick. You're, in and out of there. Of course, if there's explanation, it goes a little bit quicker. So we usually tell them results are usually within about a week. We send a letter out as well with the results. It's also on the portal. As soon as it's read and dictated, it crosses over. They could always get the results there.
Yeah. Yeah. Dr. Clark, of course, you're the one who analyzes the mammogram to determine what those results are.
Yes, and just to add to what Kelly says, I mean, I agree. It's not the most comfortable thing, but it's so important. Good compression makes all the difference as far as what I can see. And I mean, quite often we hear some comments from our ladies, which I understand, but certainly, there have been improvements over the years. It used to be that they had to, when the compression was initiated, the technologist had to do the exposure and then come around and release the patient. There's automatic release now. And for the short amount of time of discomfort and what a difference it makes as far as what we can see, what we can find, better compression is just so very important. And, but yeah, because we want to find things small.
Dr. Dan Clark and Dr. Bill Amoria, when they've both been here, they have talked in recent weeks about breast density. And 3D mammography is one thing, and it is extremely, extremely effective. But with some folks, the breast is too dense, and so there is another test that they can do to get a screening, and that is extremely helpful as well.
Absolutely. There's a big push across the country to do supplemental screening in patients who have dense breasts. The reason to do that is because people with dense breasts have a lot of white on their mammogram. Masses are white and cysts are white, so they hide against that white background. So thus, you want to find something else that's going to find the things that are hiding. There's 2 different type of supplemental screening tools that are performed in conjunction with mammography, not to the exclusion of mammography. One of them is screening breast ultrasound, which is screening breast ultrasound of both breasts completely. And the studies have shown that they find 3 to 5 more cancers per 1,000 women above and beyond mammography using screening breast ultrasound. But even better is breast MRI. And breast MRI the studies have shown that it finds 15 more cancers per 1,000 women above and beyond mammography. So we have 2, and there's advantages and disadvantages to each of those screening tools. Certainly, again, breast MRI is much more sensitive, but it's a longer test. There's a few contraindications. Screening ultrasound is easier, but again, it's not quite as sensitive as MRI. So there's advantages and disadvantages. Which of those 2 supplemental screening tools is used for each individual patient is based also on their family history and their risk factors. So it's just not a one size fits all. Just like breast cancer treatment is not a one size fits all these days, the screening process is not a one size fits all either.
Yeah, and the other 2 options that you mentioned are both available at IRMC as well.
Absolutely, yes, and we have many years of experience of doing both.
Yeah, 3D mammography is available at 3 IRMC locations too. I think that's important to point out.
Definitely.
Yeah.
And also, just as far as, I'm sorry to add into what Kelly was saying too, the other thing is that, sometimes patients they don't want to pick up the phone and call and make an appointment for their screening mammogram. That's one of those things. I mean, I'm guilty of that as well. We're all guilty of picking up the phone and making the appointment. But that's a great thing about our Walk-In Mondays is that patients who want to stop by, as long as they're willing to wait a little bit too, but they can just walk in without an appointment on Mondays to get their screening mammograms too. And we have that every day, only at the main campus at the hospital, though not at the other 2 locations.
Yeah, Kelly, on Mondays, is it substantially busier than on other days?
Yes. Yes, it is.
It is?
I think our record was 76.
Wow.
Although this past Monday we did 75 patients.
That's
Looking
amazing.
in. Yes.
That's amazing. I think that
So-
also points out that the message is getting through, doesn't it?
Yes. Oh my gosh. Even, and years ago we would do maybe 10 mammograms a day. Now we're doing like 30 is a regular scheduled day, but then the walk-in day, of course, we had plenty
Yeah.
more. And this time of year, of course, we're always getting busier just with breast cancer awareness. The end of the year, people need to get their mammograms in. So like you mentioned, the 3D places, Northern Cambria, our Chestnut Ridge site, same machine, same girls. We have appointments readily available down there.
Yeah.
So if you don't want to walk in and you do want to come in, Blairsville's from 9 to 5. Northern Cambria, it kind of changes, but we're always here at the hospital too. If you can't get an appointment, there's those other places too.
Yeah. And the bottom line is we need to impress upon folks, especially women, that it's time. Get the mammogram. It's beneficial for you, very much so.
Sure.
But your family needs to have that peace of mind as well, to know that you're doing everything you can,
Right.
that if breast cancer is there, you can learn about it as quickly as possible.
Right, right. And, it's not our intention as the mammographer to torture people. Like some people think, we're there to try to get the best exam that we can possibly can. So Dr. Clark can read it along with our other radiologists. We want to get the best exam we can possibly get for them.
In terms
So-
of training for what it is that you do as a tech at the Women's Imaging Center, is it an extensive training process?
Yes. So we are our X-ray technologist to begin with. The mammography is just on-the-job training. There are so many things that you have to go through when the new girls are coming up. We have to supervise them. They have to watch us. We have to supervise them. They have to do so many mammograms, like 75 to 100 that we all have to sign off on. And we're all working towards being board certified. We have a couple people up and coming that they're on the books to get take
Yeah.
their board. So, but the rest of us are, all there. We have a good group of girls that have lots of experience.
Yeah.
So-
Dr. Clark, that must fill you with a lot of confidence as well, to know what that team is all about.
Absolutely. You never know when you come someplace new. I've been here for a little over 3 years now, and I'm so very thankful for the wonderful team that I have in every department, but from the mammography technologist, the ultrasound technologist, and the MRI technologist. Really, really very kind, caring people. And of course, then there are my nurses during biopsies and everything. I have just I'm so very thankful for the kind, caring people that I am able to work with
Yeah.
and that help me take care of my patients.
Wonderful. All right. So walk-in Mondays, you can go in anytime at IRMC's Women's Imaging Center on Mondays. Between what hours?
7, and the last appointment's like 4:45.
7 and 4:45. Make an appointment if you want to come on another day. And for somebody to do that, what is the phone number that they should call?
357-7075 is our scheduling.
There you go. You'll get the scheduling center there. Thank you both for coming in to visit with us again on Breast Cancer Awareness Month. We appreciate it.
Thank you, Todd.
Thank you.
It is the voice of Indiana County. It's WCCS 101.1 FM, AM 1160, and WCCSradio.com. Boomer Sports next, and then it's a visit from the WCCS newsroom with Matt.